Mr. Smith is a 21-year-old student attending your clinic today, complaining of painful ulcers on his lower lip for the past 3 days. He is a law student and is under stress because of his upcoming final in 2 months. His sister is similar answers. Others the patient's concerns, gather information, and be the possible causes of the ulcer.
The pointers here would be address the etiology of the ulcers, give a good history of the site and occurrence of the ulcers, and perform thorough info gathering to seek out as much information as possible. Let's dive into the role play now. Hi, Mr. Smith. Welcome to our surgery. How are you doing today?
Hi, 30 pounds on being well paid at and be happy to go look through it.
Yes, absolutely. Can you tell me more about this? How long have you had this for?
I've had this for about 3 days and then it started to really work, especially when I eat something, even if it's not spicy.
All right, that sounds very painful. Have you had these kind of ulcers in the past as well?
Yes, sometimes, but I'm not really able to pinpoint when.
Okay, and do they go away on their own?
Yes, I'm never really bothered what's the system.
And when you've had these ulcers, have they been associated with any fever or swelling or any other problems?
Clearly, especially not this time.
Okay. And do you remember if you've had any broken teeth or anything that may have happened just before this ulcer had come?
Well, the law student really get into the work.
Okay.
So,
Right. Okay, that sounds assuring, but just wanted to recap as well. Do you have any medical problems, medications, allergies?
nothing that I'm aware of.
Okay. And what about any recent infections? Did you have any recent, were you ill or sick recently?
Well, I've been quite well this day.
Okay, that's good. That's good. And can I ask, do you smoke or drink alcohol?
Yeah, I do drink alcohol probably every week and a substance. Small. So
All right. Okay. And how's your lifestyle like at the moment? Are you doing okay? Do you feel stressed, or how would you describe your current state?
definitely stressed. I have myself coming up to some about to do and how many years, it gets purely stressful. Definitely stressed. And quite stressed about exams because, I yes.
Yes, absolutely. And that does sound quite intense as well. Yeah. And good luck with that. I'm sure you will do really well. What about any changes to your oral hygiene practices? Or any changes to your toothpaste or, a recent toothbrush or anything at all?
Not really, I just buy them if it's cheap. So, I think it just change, I just change them once in a while with the air fryer.
Any changes to your diet recently?
Just the same.
Okay. So you have not had any problems, any reactions to foods or anything in particular?
So, nothing that.
Okay. What about any family history? Does anyone else in the family have these kind of ulcers?
Yes, my sister actually sometimes gets these ulcers. Not really sure what she has, but then I will go to the TP for it. Saturdays.
Right. Okay. Now, by looking at what you're describing, and also I could get a brief look at the ulcer as well. I would say that there could be many causes to this. So some of them could be that, like I said, if there's a broken tooth or something sharp, that could also cause like a traumatic ulcer. So the other thing that I was asking you was about any recent illnesses, because sometimes viral illnesses can lead to these kind of ulcers. And yes, from what you've described, you do have some significant stress right now, and that also can cause ulcers in some people. Also, I know that you did say that you don't have any medical problems, but it's a good idea to check with your GP as well, because sometimes vitamin deficiencies can present as ulcers in certain, yeah. So it's a good idea to see your GP as well, just to get an updated blood works and things like that. And also, if you're allergic to something, some people, they may not know about it, but the allergies can present themselves as ulcers in the mouth.
Okay.
Yeah. So now what I would suggest is we'll start by looking at the mouth. So before that, I'll just do some examination of your jaws. I'll just check for any lumps and bumps around there, and then we'll go around and we'll just look at the teeth. We'll check the tongue, and we'll just have a look around, and I'll just check your gums briefly with an instrument as well. And these are all a part of our routine exams. So I'll also just take the some pictures of the ulcers, and I'll also note the size and the quality of these ulcers. And once I've had all of that, I'll just record that into my notes. And once that's done, I've also suggest a couple of x-rays today. That way, I can get to see if there's any other problems arising around the teeth, or any issues inside the bone or anything like that. That's something that I would be able to see on the x-rays.
Okay.
Once we've finished the routine exam, I will, and then we can discuss some of the reasons or the causes that this may have arisen due to. Some of these ulcers are actually termed as aphthous ulcers, so which means that they have a stress origin to it. And I do believe that in your case, yes, you do have a little bit of a stress. Again, this could be, so this could be a reason as well. People, they have it because of viruses, so it could be a viral ulcer. Like I mentioned, if there is a sharp tooth or a sharp substance which is impinging on the tissue there, that could also be called as a traumatic ulcer. So depending on what the cause would be, we will then move on to manage this. So first, by looking at what is causing it, we should try and eliminate the triggers. And I would also definitely suggest working on stress management as well. Have you given a thought about it?
We're really so stressed with uni that I don't have time to think about it again.
Yeah, no, I can imagine. It's definitely a good idea to touch base with your GP on this regard as well. They are able to provide you with many resources, because some people find that the moment they manage the stress, the ulcers reduce in frequency and occurrence as well. We will give you some local numbing gel sort of a thing, which will also help you with the pain. For the time being, will help you with eating as well. And I would recommend a non-alcoholic mouthwash, just to keep the area clean and bacteria free. And I would still refer you to see your GP, because just as we talked before, we don't want to rule out any vitamin deficiencies or any underlying causes that could be leading to this. And I'd like to see you back in my surgery in the next 2 weeks to make sure that there is some improvement, because if it isn't, then we will have to then let you see a specialist.
Okay, sir.
Nothing to worry about at this stage. The only reason why we talk about a specialist referral is because any ulcer that's persisting for longer than 2 weeks without improvement needs to be looked at. So, yeah. Any other questions for me, Mr. Smith? I hope I have been clear so far.
Yes, quite sure.
Yes, absolutely. Are you okay with us to proceed with the investigations?
Oh, yes, sure.
All right.